believe Paula on our way. Angel is absent with notice. Gershenson.
Here.
Jackson.
Here.
McGilvray is absent with notice. Nelson.
Here.
Tevet.
Here.
Joliet.
Here.
Luke.
Here.
We have a quorum.
Thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I will entertain a motion to approve the minutes for May 16th, 2023. I have a motion by Commissioner Joliet, support from Commissioner Jackson. All in favor say aye.
Aye.
Opposed? All right, the minutes are carried. I will need a motion to approve our agenda. I have a motion by Commissioner Nelson, support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? The agenda is approved. We arrive at our first public comment. This is for comment on items on the agenda. Is there anybody from the public wishing to comment? Our first public comment is closed. We move to communications. There are 5 items under communications. An application to Enbridge for 2023 Safe Community First Responder Grant Program. The second item is the April report from our animal control intake disposition. The third item is an amendment to the Michigan Juvenile Mental Health Treatment Court Program. The fourth is another amendment to the Michigan Veterans Treatment Court Program. And the last item is an amendment to the 2023 Paul Cloverdale Forensic Science Improvement Program. Any comments on communications? Who would like to make a motion? I have a motion by Commissioner Nelson, support from Commissioner Jackson. All in favor say aye.
Aye.
Opposed? Communications is approved. We move to our presentation by Oakland Community Health Network, and we have Dana Lazenby here to provide information to us. I will need a motion to receive and file this report. I have a motion by Commissioner Joliet, support from Commissioner Jackson.
Thank you. Good morning.
Good morning.
Morning. Should be used to these microphones.
No microphones needed.
It's now in the ceiling.
Oh, can you hear me? Everybody can hear me?
Yes.
We need that. So good morning, everybody, and thank you for having us here this morning. I'm Dana Lazenby, the CEO for Oakland Community Health Network, and I have with me Adam Genovi. He is our Chief Operating Officer, and of course, I think most of you know Christine Burke, who is our Chief of Staff. We wanted to come today and just give you a high-level overview of our services and supports. We also wanted to thank you for your support over the past, it'll be 3 years I've been here, August. Yes,
Wow.
time flies, right? But we wanted to thank you because we know those partnerships and the commitment you have to the citizens of Oakland County really has benefited the community. And we want to continue in our work together. So I'm going to do a high-level go through, right? But I think you all are very, very familiar with what we're doing now. I hope our work is getting to the public as much as we can because we know that's our role is really to help the most vulnerable citizens of this community. So I'm working this, I think. Okay, so I think you all know we're the public mental health system or behavioral health system. And what that means is that we provide services for individuals who are primarily Medicaid or uninsured, and individuals with mental illness, individuals who have an intellectual or developmental disability, autism, substance use disorder, and anyone in between. We're very focused on integrated care. And integrated care for me and my team is really about looking at the social determinants of health. So it means housing, food security, transportation, education, job training, working with the criminal justice system, and our justice initiatives. It's really the whole health of the individual and the community with their families. So we talk about integrated care, and I think sometimes people think about integrated care in a way of funding, and some people think about it in a way of physical health and behavioral health. But when we think about it at communal health, we think about it as the holistic health of the person and their family. So we've been around for we were a part of the county, and then in 1999, we actually became an authority. So what that means is we contract directly with the state, and primarily our funding comes from the state and federal government. So here are our strategic focus areas, and I like to put them in simple language, but I also will follow our strategic plans. Really, we're talking about staffing and retention. You know, we have a huge workforce crisis in our community and across the state and across the country, especially as it relates to the services and supports that we provide. So we're really focused on how we keep a well-trained, qualified workforce, but also how we retain and recruit those individuals that they'll want to stay, be trained, and work in Oakland County. The other thing is looking at a quality system of care. So we know that we're not a perfect system, but we're working on ways to continually make improvements to our system and have good outcomes for people. So we use service models a lot with our providers, but what I'm finding is we need to look closely at outcomes. So you can provide a service, right? You can check it off and say, I did this, and I did this. But if the person's quality of life has not changed or moved the needle, then we want to make sure that we're doing things that make sure that people stay healthy, out of the hospitals, out of jails, out of institutional settings as much as possible. And as a clinician, mine is least restrictive level of care, right? We want people to engage safely, be happy in the community, and have the things that they need that any one of us around this table would need. So the other thing is administrative and service delivery. Again, looking at our network providers, we have over 300, and these are various providers who do outpatient work, inpatient services, residential services, vocational services, jail services, crisis services. So we have a huge system of care, right? We also want to look at the quality of work that they're doing and making sure that what we are saying we're going to do, we actually provide. So that's very critical to us. And then looking at how we manage internally as well as externally with working with our partners is very critical. And working with our partners means our providers, and really the people we serve. We do a lot of data collection and looking at heat maps and seeing where the need is in our community. And we even have some ideas on how we can do that better. Finally, integrated healthcare, I think I addressed that. And then our partners, we consider you, of course, a partner, a very important partner, because we want to align our goals and objectives with what you all have set forth as the goals and objectives of the county. So here, multitasking. So here we have, what do we do in our community? So we have a care safety net, and we are responsible for that safety net, and that includes crisis services. So we have, of course, our contract with Common Ground, who provides crisis service within a facility. They also have mobile crisis teams. And I have to admit, our mobile crisis teams aren't doing enough because we don't have, again, the right staffing to make sure that those services are available as much as they should be. So the other thing, we have a crisis stabilization unit for adults, which is a 16-bed unit that can have people there for up to 5-10 days. And that is an alternative to inpatient hospitalization. So these are individuals that are voluntarily going into a residential setting so that they can receive the services and supports that they need. And we consider it almost a diversion from being in inpatient care. The other services we have are, I think you're aware of our crisis stabilization unit. People can stay for up to 72 hours before they're diverted to another level of care, or actually receive services so that they can go home and engage with an outpatient provider. We also have the sober support unit there, which is very unique to Oakland County. A lot of other counties are trying to mirror this sober support unit. It gives individuals who are challenged with an addiction and seeking recovery services and treatment, a place to go before they can go to a facility that will accept them. And really proudly, I talk about our Youth and Family Care Connection Center, which is that 8-bed unit that we have newly opened this year. We had a soft opening last year, but this year we are operating and we're not quite at full capacity. Again, we're seeing some of the challenges that the regular workforce is seeing and making sure that we have the right people there to support our families and youth when they come there. We serve youth from, I think, about 12 to 17, and we also are able to connect children and families to services from that unit. The great thing about that is we're getting people out of the ED. We're hopefully diverting families and children and youth from going to the EDs, which we know when they're in ED, they're just sitting and waiting. They're not actually starting services.
What's an ED?
Oh, I'm sorry, emergency department, or emergency room.
Okay.
Yes, yes. So yeah, we're talking a lot of little acronyms. The other thing about that is it is also a receiving area in terms of screening and assessments. So even if the child or the family is not in crisis, they can come there and be connected to those services and supports. And it's really a warm handoff as opposed to, sitting on the phone and waiting for an appointment and those things. So we just need to get the word out that we're open and ready to serve. We've had quite a few state reps and senators and other people who are concerned about the level of care we provide, not just us, the entire state, coming to tour our Youth and Family Care Connection Center because it's it's the only one that we are aware of in the state of Michigan. And so the director of the state actually came, Director Elizabeth Hertel, and she was very proud that we had this center. And once she knew we were up and running, of course, we're gonna get a lot more people interested. And so we know we need more than those places. We got this through a SAMHSA grant, and we know that they'll be ending. So we were looking and working with the state to make sure that we can continue to fund the services and supports that are provided there. Community collaborations, which you all know very well, of course, that we're working with you on several different initiatives that we are very proud of. The School Mental Health Navigators, the Oxford Benefit, the CIT Crisis Intervention Team Training, co-responders, which we know we need an expansion to. And so we're doing what we can to fill in gaps. So when we do our annual needs assessment, it is really looking for those services and supports that should be available and are not, especially as it relates to our crisis continuum of care. We are also working with our hospitals. One of the things I noticed when I started is that we had a lot of individuals waiting in emergency departments, waiting beyond the typical timeframes that they should wait. So no one should really sit in the ED more than 23 hours. So at that point, we have hospital liaisons that engage and work with our hospital partners to make sure that we're finding out what are the barriers to care and actually going there to help and trying to resolve those issues and get the person moved as quickly as possible. So that is something that we definitely have expanded on. We actually hired 3 more hospital liaisons because we know that relationship building and going into the hospitals and knowing the individuals that work there really does help to build those relationships so that you can get people where they need to be so they can begin their treatment and care. And it also helps with diversions in terms of if a person can have a lesser level of care or less restrictive level of care, we want to make sure that those options are available to those families and to those individuals we serve. And we also want to make sure that they're linked to their provider if they have one, and if they don't, making sure that they get that warm handoff or that warm engagement with the provider so that they can begin the services and supports that they need immediately. Our justice initiatives, I won't spend a lot of time on that. I hope you all are aware of those. We do have information available for you on our crisis intervention team trainings, which is a 40-hour training with our law enforcement partners. To date, we've trained over 1,000 or more officers in Oakland County. We also have our co-responders that are really ride-alongs with the police officers. These are mental health professionals that will work and help to what's the word I'm looking for? Just to relieve the situation. So if an individual is having a mental health crisis or a psychiatric crisis, they actually can get the services and supports they need as opposed to being arrested and taken to jail. So we also are proud to say we're sponsoring a dog, our care, what do they call, our Comfort Canine, thank you. And we have Little Hope, who's the dog that we actually sponsored with the Sheriff's Department, and it's getting rave reviews everywhere this Little Hope and her team goes. It's such a great moment to see people really, even if you have the dog in the room right now, we would all be paying attention to the dog. What I had to say would mean nothing. So it's been very good in going throughout the community, through schools and in employment situations, anywhere there's stress, they've been called on to bring this Comfort Canine, our Little Hope, to the different various partners we have. And whenever they are calling, we actually don't get involved in the details. We let the sheriff's office decide and go where they need and where they're called. Finally, a youth and family focus. I think when I talk about a system of care, that's one of the things that is really critical, because we often see families showing up and they're concerned about not having certain levels of care. And we know that's an issue that needs to be addressed, but it's multifaceted. It's not something that we can address with one quick answer. If there were, guess what? I would definitely find it and try to put it in place. And our team is dedicated to working on that. So we have individual families that, you know, we work with our providers to make sure that they're getting the services and supports they need. And again, we're not perfect in doing that, but it's something we continually work on in terms of providing support and technical assistance, making sure that what's going on with the families, that we've exhausted all of our resources at this level. And if we don't, and when we do, and we still need an answer, we go to the state. And so the state is there to provide technical assistance and support to us, but also to keep us accountable. Because my belief is that we have to be accountable to each other. I have to be accountable to the community and people we're responsible for, but we also have to hold our staff and our community partners accountable as well. And school partnerships. We're very proud of the school partnerships. And in fact, I do want to brag a little bit. Our chief medical officer is actually the American Psychiatric Association chair, board of trustees there. He's a speaker, which is a very high level position, but it also affords us resources at a national level. And in fact, we have some school training that we're being supported and providing to some of the schools that are willing to participate with us, called Notice Talk Act. We're doing it with several different districts, and we are looking for more partners to do this school training, mental health training. It's actually for the students and the staff, but it's also, they're doing it in work environments as well. The other part of this great relationship is we went for a fellowship, a diversity fellowship. It was important that we have people in the community that look like the people we serve. And so when we went for this fellowship, we were actually given 3. So we're excited to say that they'll be starting in September. So we have 3 fellows that are actually psychiatry fellows that will be working in our community. And our hope is that we can keep them and encourage them to work and stay in this community. So I will move on, and we already talked about our, thank you, Adam, our clinical and law enforcement co-responder programs. And if you see, we provided services to 1,640 people in crisis, and they've received referrals. And the great thing about our co-responders is that they stick with the individual until they are connected to services. And so we want to make sure that's a critical part of this. And if they choose not to stay connected or don't want to work with us, that's one thing, but we make sure that we connect them. Thank you so much. I talk a lot, so excuse me. So right now we have co-responders in Auburn Hills, Birmingham, Bloomfield Township, Pontiac, Rochester, and Troy. So our hope is that we can get additional support so we can extend it across the county, because we do see that it's working. And so we have data that shows that it's working well, and training, ongoing training is critical. So the crisis intervention team training is another proud program that we have and we work together on. And our RCC, I already talked about that RCC. What is unique about the RCC and Common Ground is that there is a drop-off station so that when law enforcement comes in contact with somebody who needs mental health services, they don't have to take them to jail. They can drop them off at Common Ground. There's a section specifically for the ambulance drivers as well as police officers. So a lot of folks don't know that, and so we want to say that our children can go there, our youth, our juveniles can go there, but our hope is that we can build on that and make sure we keep it separate, because we want to keep our children safe. We don't want them to walk through the area where we have adults being served. Our school mental health navigators, I already talked ahead of myself, so I won't go into any details on that. But it is working, and we have, out of the Oakland County schools, worked with 398 schools out of the 458 schools that we have. So we're continuing to work and grow that program so that they're just not doing presentations, they're actually engaging with individual families who have a need. And they can do that now, but we're not seeing that pick up as quickly as we would like it to. I already talked about our Youth and Family Care Connect, 17 years of age, up to 72 hours. And people often ask, what happens after 72 hours and you don't have an identified? We can extend that time. We also don't necessarily want to. We want individuals to keep moving to get to the best level of care that they can get to. And so 72 hours is rare, more than 72 hours, I should say. So when that happens, we know that this is a critical need that the family or the youth may have, and we want to work more closely with them to make sure they get connected. And the other thing about this, our system, actually we have our partners with Easter Seal. We actually extended our network of children's providers because our partner Easter Seal says that they are at capacity. So we don't want to get into a situation where families are waiting longer to engage because that hurts the other side. Then you'll see more families in crisis. But we also want to give more options so people can go and be seen as quickly as possible. So we've added 5 additional children's providers to our network. And these are providers that we already have working, but we want to have other options in the community so that we have families being seen as quickly as possible. So we talked about the Oxford School Mental Health Funding Assistance, and what we found is a lot of families weren't taking advantage of this program as much as we wanted, or as well as the School Mental Health Navigator program. So we had to tweak some of the requirements and criteria. I think initially we were probably asking for too much information to find that people were eligible, and people were a little hesitant about giving all of this information. So we looked at that and we wanted to open it up because we know this is a valuable resource for families to have. So we are the safety net, and we, again, have a crisis response and the deployment with our partners, and even we had a deployment of our CISM team, which is Crisis Intervention Stabilization.
Stress management.
Thank you. I can't remember my own acronyms, but we are proud that when something happens, we can respond to the community and go in and provide those initial supports, and then also link people to services and supports that they may need. And this is regardless of what type of insurance or funding they have. This is something that we saw a need for, and we wanted to grow in that area, especially after we saw the need increased so much after the pandemic, but also with the Oxford tragedy and those things, we needed to do more than just take care of our kids and the families in the community. We also needed to take care of the people who are taking care of our kids and the families in the community as well. So we wanted to go in, and we noticed that, it's like you can't heal yourself, right? And we saw the dedication of teachers and school administrators really being a part of the solution, which is great, but they were still struggling with their own trauma response to what was going on. So we wanted to create these teams that are trained and able to go in certain situations and support the employers or the teachers, administrators, or whatever situation it may be, if we're called. And we often hear about things on the news and things of that nature, so we want to make sure that we can respond to those things as well. And so we want to build that expertise to make sure that we have enough to address the needs that we see coming up. So the other things are about the contacts we have specifically related to the Oxford benefit, and then the email contacts that we get asking for supports and services, and sometimes just information. And so we're sharing information with schools and working with them. We know our partners, our providers are in the schools, which is great, but it's not enough of us to go around. So we want to make sure that every school in the Oakland County has at least a connection to those needed behavioral health, mental health services. Hospitalization is a big deal. So we spend a lot on hospitalization, and a lot of the money is matched by the state. But we also know that through our work with the community, there is a greater need, and certain areas have a bigger need than others. And so we want to have a bigger presence in terms of looking at, even looking at the region, Oakland County, and breaking it up into 4 areas so we could specifically address the needs in those areas. So we know in southern Oakland County, we have a lot of resources, right? But in the northern part of Oakland County, we see because of the geographic spacing of things, we may need to add more mobile teams and other things so we can be responsive to the need. And also looking at our partners, we've also worked so closely with Oakland County Health Department. I see my little partner in crime over there. That we realize working together is better because we're able to work with hospitals and say, how can we help support what's going on in this particular community? And so just like we responded to other tragedies and events, we want to make sure that we're not leaving any community out. And I see that it's a range. So when we have these huge things that happen that are really bad, but sometimes it's the little things, and if you promise to be the safety net, you have to go to where we're needed. And so we are making a committed effort to work with our non-traditional partners like a Family Empowerment in Pontiac and other entities to make sure that they know who we are. So when they see people more than we do, like the faith-based community, they see people more than we do, they have the information to pass it out and give to the people they serve and they help. So that's very critical to what we do in getting the word out. If you notice any of our business cards, even of our board members, on the back of our cards, we all have crisis information. Who to call when you want to access services and supports. We now have church fans. I grew up on church fans, right? So we have our access information. And one of the things that we want to do based on those 4 quadrants or areas is have this resources specific to those areas. So we have a lot of great things that we're trying to do. We just have to make sure we have the resources to continue on and to build on some of those things. And so our plan is also to look at those low-hanging fruit, is what I call it. Those things that are really no cost and just as an added benefit to people we come in contact with, people we serve. Okay, our budget. This is the hot topic of the moment, right? So our budget, and this is what we received back in 1999, was $188 million. Now our budget is $442.7 million. But we've grown and we do more with what we have. And since 1999, our budget or our receipt from you has been the same, $9.6 million. So we wanted to talk about how do we, and even the board is encouraging us to come to you and have this conversation about how do we increase that amount. But we also wanted to talk to you and not come up with this big proposal, but really get your feedback on how you see us working better together. And funding is a big part of that, but we want to do more. But of course, staffing is always an issue. How do we work together to make sure that we're addressing the increased need of the community? So we're in the schools, we're working with the faith-based community, we're working with neighborhood entities, we're working with law enforcement. So we really didn't want to just come here and say, look, you haven't given us an increase since 1999, but we just wanted to show that in working together and the support that you've provided through other programs, it is working. Is it perfect? No, we know we're not a perfect system, but none of us are. And so we're really trying to build on our successes and then look at the what I would call some of our inefficiencies and really directly answering and responding to those needs that we have internally and working with our partners. So that's really important. Sometimes it's a hard conversation to come and say, hey, we need money. But we also want to show we're doing the work. And so in doing the work, those conversations get to be, and the work gets to be, everybody's not happy, but you have to do what's right for the people we serve. And that's first and foremost. So with that, I think I'll stop. I think I should. Hopefully I didn't go over my time.
Thank you.
Thank
So,
you.
on behalf of the city of Troy, I wanted to say thank you. They do utilize the co-responder program and it is working well.
Good.
And you also mentioned 5 additional providers for children and families. Who are they?
They are CNS. Okay, let me see. CNS, 2 or 3, TTI, which is Treatment and Training Innovations. Easter Seals is already a provider. These are additional, so the, Hagera Health, and 2
OFS one
more.
of the new ones or the original OFS?
OFS is expanding, and I can't remember the 5th one. But I'll get it back to you.
Thank you.
Definitely.
So, and then you mentioned staffing and retention first is one of the areas. What are the plans right now for staffing and retention?
You know, one of the things that we talk about, and it's all staffing, but really direct care workers we know are our real healthcare heroes. They sat with people and served people during the entire pandemic. And even when some of the individuals had to go to a hospital unit, they actually went with them on the unit to support. So our direct care workers are first and foremost, and they are the most underpaid, like school teachers. They are underpaid, but they do a whole lot to really support what we do. And so one of the things, if we maybe ask around the room, who in this room ever worked as a direct care worker? So that's one of the things that we're talking about with our providers and the community. It's like, let's talk about a career path like we have for nursing assistants or paraprofessionals or other healthcare professionals. This could be a starting position and way to get experience to go further. So I know I worked as a direct care worker in a hospital and a residential setting. And I know when I started working for Merck 20 years ago, I actually had to work in a home for 2 months. 2 weeks before I actually went out and worked in my regular position. So we want to expose people to the job. And it's not easy work. It is challenging work, but it's very rewarding. So that's one thing, is really talking about what do direct service professionals or direct care workers do and exposing them. We're also looking at students and internships. We have a partnership with Oakland University and some of the other universities to really go to their job fairs or their career fairs and make sure we're telling them about opportunities around the county. The other thing that we did with direct care workers was we did a rate increase. So we took it upon ourselves to really create a way to provide a $2 increase. We did it with specific homes because we wanted to pilot it first. The problem is with a pilot like that is you can say, I'm giving you $2 increase, but when the pilot's over, how do you take that $2 back and then expect people to stay and do the same work but less? So that's the problem. So we hopefully have a permanent solution with the state, but we're not quite sure because you can put it in the annual budget to do an increase, but unless it's changed as a permanent change, it's really hard to maintain and sustain that without proper funding. The other thing is looking at career paths for, not just for our mental health professionals or behavioral health professionals, but really the training piece is critical because we have, for example, our serious emotional disturbance. I hate that description of children, SED waiver. They require more intensive care and services and wraparound care and services in the home and in the community. The issue that becomes of that is that you may have somebody really dedicated to doing that work, but it's very challenging work. They need a higher level of training. So we need to be able to provide ongoing training at a higher level, almost like a behaviorist, to make sure that the person is equipped and ready and has the resources to support the child when they're at their weakest moment, or the families at their most trying times. That's when we see staff leave. when they get hit or called out their name. I mean, this is a difficult job. And so even with all the tools in the world, sometimes you don't know what to do, right? You're in the midst of something. So we really want to make sure that we're creating a network of direct care workers that are trained and ready and want to stay into the work. But pay is a big thing. Our direct care workers are lowest paid. They have transportation issues. They need childcare if you want them to come to work. Some of our direct care workers actually stayed in the home with COVID, helping other people who live there with COVID. So that's the dedication it requires for someone in this position. So it almost sounds impossible, but we're really looking at ways that we can really recruit people who are vested in doing this kind of work. A lot of students who are studying social services are interested, and then sometimes they come and work with us and they're like, oh, I don't think I wanna do this. Or they're so passionate and they love it so much, they stay. So that's the whole ideal behind it, but we really just need, our workforce overall needs to be a training ground so that we're continually giving people the tools and resources that we need. I've been doing this 30 years, I don't think there's been one year that's the same. So it's a constantly changing and evolving system. And it's political, so when your leaders change, some of the rules change. So keeping up with that kind of thing, and we don't want our direct care workers and our teachers and other folks have to worry about it. We want to provide the resources and tools so they can do it and take care of the people we need to take care of.
And we've had conversation in the past about a certificate program for direct care workers because they are a need and they are the lowest paid. So regarding salaries, not just for direct care workers and clerical, is there consideration of salaries for therapists who do outpatient and home-based services?
We've done that with our providers in terms of their rates, increasing rates so that they can pay their staff who do the clinical work more. Sometimes I think we can't really force the issue, but we can fund for the issue, hoping that our providers pass it on to their teams. And often when they don't, we hear about it. So, yeah, we can't be a co-employer. And so some of that, I have to listen to the attorneys, right? To say, you're not in a co-employment. You can fund a program, but you can't force that the provider increases the rates. But once you put it out there, people know to look for it. So that does help.
Thank you. Commissioner Powell, followed by Commissioner Nelson, followed by Commissioner Cavell.
So I don't know if this is the appropriate time, and if not, you can say that's that's a different topic for your presentation today, but you know I have an autistic nephew, and I do want to say thank you because the therapist or the ABA therapy location that he goes to, we had a situation, but you all are reaching out to them because there is a shortage in the locations that's needed to service the autistic kids. So I wanted to ask you, so thank you all for that. So what I want to explain to my colleagues is that we had an individual who applied to be one of the ABA therapy locations, vendors or whatever. And she had a couple hiccups in her proposal, but it was things that they could work with her to help her to still, so she could continue to provide these services to these kids. And she was a minority. So we're a shortage of minorities in this space to help in the ABA therapy space. So thanks for that. But I also wanted to know, I see this budget, and I know that there's gonna be a lot in that space. So is that included in this with the ABA therapy that we're offering? Because I know you had some challenges in that space and you're trying to work to pull that together. So I wanted to know, is that in this or is that even additional more eventually with that piece?
That is in this because
Okay.
honestly, we haven't finalized our end of the fiscal year. Of course, we'll have all of our stuff together. But going forward, whenever we plan something, we look at programs and their sustainability. And so we do it with what we have, right? We know if we had more, we could do more. So programs like that, we were already looking at expanding our network of providers. And how do we look at that to say that we can't just put anybody in the network, right? And so if somebody presents something to us and it's not right, then they don't get get issued a contract. But we can do provisional things so we can help them get ready because we do need providers in our system. We don't want families waiting for services. So our providers do things on their own, which are expanding. They have other funding sources, which is amazing. But that's our primary responsibility, is to ensure that we have capacity in our network. And so when we don't, and we have people waiting for services, we have the ability to open our network up and take on more providers. But they have to have certain things and standards and be credentialed and all those things. And they take time. For example, with the SED or the serious emotional disturbance waiver programs that we have providers that are ready to go. They still have to go through the hoops and the challenges with the state and training and making sure that they have credentialed people to do the work. So it takes a little longer than what we would like, even when we do provisional acceptance of certain providers. But the provider you're speaking of was ready. It was just her proposal needed she needed technical assistance and consultation. If we don't do that, then we wouldn't have anybody working in our system. We have to support the community so that they can get out there and begin to start services.
So to me, that just explained and showed that we do have organizations or companies willing to help these up and coming within this space. So thank you all for doing that. Thank you.
And I'll tell you, just to piggyback on that, we are always working, I believe in continuous quality improvement, right? Internally too. So we're always working on how are we serving our provider community and how do we support them? But also we have to make sure there's accountability and that they are doing what's right by individuals. I mean, we hear stuff all the time, and some of the stuff is our responsibility and some of the stuff is the provider, and some of the stuff is just we don't know everything that's going on and what's making it complicated, right? So we work with all of those things on all levels. And the thing I'll say is I don't have any issue with anybody telling me something we did wrong, because I want to know so we can correct it. Because we're not perfect, but we want to know, because if one person walks away with a bad experience, then other people will be less likely to come and seek services. They're like, well, I'm not going to call. They're not going to help me, right? Or I had a problem, and they're going to be a different way towards me if I report I had a problem. No, we are required by the state to have a recipient's rights office. We are required by the state to have customer service standards. We are required by the state to take all grievances and complaints. So people have rights, and the issue we take is sometimes they don't know that they have their rights, and their services are suspended, terminated, reduced, or whatever the case may be, and no one told them, you have a right to an appeal to that. And so those things are critical to what we do, so that, like your situation, providers have rights too. And so if they found they're not accepted as a provider in our network, they have a right to come back and say, why? Tell me why I can't provide services within your network.
Thank you. Commissioner Nelson?
Thank you, Madam Chair. Just kind of piggyback initially off of what Commissioner Powell said, the work that you and OCHN does is valuable, and it is not an easy task. As a board-certified behavior analyst providing ABA therapy, I'm on the front lines and on the ground, so I understand the work and the delicate intricacies that really do go into place, especially when you start looking at trying to expand that network and looking at how do we get quality providers. With that being said, one of the things that you had said initially is that, and I'm hoping I'm using the right word when it comes to contractors and subcontractors.
Okay.
So from my understanding, for example, Easter Seals, Mork, one of the bigger contracts, right? And then underneath Easter Seals and Mork, then you have your subcontractors, right?
Yes,
Knowing that it sounds like both Mork and Easter Seals have just been flooded with individuals seeking services, also knowing that you have supports coordinators, right? And so having those supports coordinators already with your two largest contracts being almost at capacity and then some, what quality assurance measures are put in place for when you are accepting those subcontractors coming in? Because each entity that subcontracts out has to have supports coordinators who are overseeing the clients that may come from Easter Seals, MORC, and then some. So knowing that we're at capacity at Easter Seals and MORC,
And they're
but yet
what
we're
now?
opening up,
Right.
which we need to open up more quality providers, but knowing that a subcontracted entity has to feed through MORC, Easter Seals, and I get that there's, and then some others, but
Yes.
the largest. How does that impact subcontractors, knowing that, sure, I can open my doors and bring in all these clients, but they're filtering through still Easter Seals and MORC, and they're already strapped for supports coordinators. So what quality assurance measures are being put in place? And it's a very tricky question that I'm asking because I know the value of increasing those high quality service providers, but I also know it always filters back up to Easter Seals and MORC.
And to us, because if
Exactly.
they don't perform or they do something that violates the rights of an individual or is poor care, just
Sure.
poor care, the state is not gonna call Easter Seals or MORC or one of those they're gonna call us.
Sure.
Hey, your contracted provider did X, Y, and Z, right? And the families will call us. Hey, I received services from MORC and da-da-da-da-da, right? One of the best examples, and I think you hit on it, supports coordination is critical, right? Supports coordinators need ongoing training. So as we develop new programs, we have to make sure we're communicating with our providers and giving them the tools and resources. We have a full direct training department. MORC has a training department. MORC trains direct care workers. We train direct care workers. So bringing that all together and coordinating is critical. So we've done those things. But going back to your specific question, for example, during when we were coming back into the community and people were returning back to their vocational programs and things of that nature, we got a lot of complaints about transportation. And MORC contracts with transportation. We contract with MORC, so MORC provides transportation services for a lot of individuals. Well, individuals on their way to workshop sneeze. Somebody sneezes, they're like, oh, you gotta go back. So they were taking people back home. And even we've had a conversation, my board is so dedicated to making sure that we improve transportation. That's a huge thing. But they were taking folks back home because they sneezed or something happened. It's like, oh, we can't have this many folks in the van. So it's really impacted our vocational providers and transportation providers. But when we hear about something like that and we know it's not really realistic, we have to address that through MORC. And so that becomes part of it, but also we have to go back to MORC and say, how did you address this issue? This is your contractor. And so making sure that they are taking accountability for their contractor's performance, because we take accountability for our provider's performance. So there's ongoing reviews that happen, and the review process is really annual, but when we have an issue that comes up, we have to address it within a certain time frame.
Sure.
So it is a challenge, right, when you have somebody who's working within somebody, but it's their name that's on top of that person, and they have to do the due diligence to make sure that that provider is within the standards and following what's set forth by the state. Because they are accountable, and like I said, we are ultimately accountable. If they can't resolve it at the sub level or the direct contractor level, they're coming right at us.
Well, I appreciate that. Thank you.
Thank you.
Thank you. Commissioner Cavell, followed by Commissioner Joliet. And
You mentioned a few things about hospitalization, both short-term and long-term. And I'm just curious what that need looks like. So how many, because you said a few numbers about beds, and I know there's different types of beds for different populations. But can you just kind of do like a funnel of there's 10,000 people and there's 100 beds for this many?
This is complicated, but
Okay, yeah.
I'll try to keep it as simple as possible, because it takes many of us years to figure it out, right? So what the state does is they have a certificate of need. And so they look at inpatient psych beds very differently from general beds in the hospital. So they look at area and need based on a population formula, they determine how many beds are needed in the community, right? And so various hospitals, you have, Pontiac General, for example, they have 70 inpatient beds. They also have put in an application to go up to over 100 beds. Those beds may be specific for children, adults, geriatrics, older adults, or they may be specific to individuals with intellectual and developmental disabilities. So on paper, they will have a number of beds. In actuality, it could be impacted by staffing. It could be impacted by the acuity on the unit, how much is needed by the current people who are there on the unit, or it could be impacted by just having an individual who needs their own room, or it's a mail room and not a, so those things all go into it. But the bottom line is, even though a hospital has, and I'm talking about community hospitalization, they may have a certain number of beds listed with the certificate of need at the state level, doesn't mean all of those beds are in operation or available for admission, right? The other thing that can come, if you have somebody what we would call familiar face, somebody who comes to the ED quite a bit, the emergency department, and is seeking admission, that person has a tendency to get a reputation. And so if they did something pretty horrific or not so easy to care for, a hospital will deny them, saying that they cannot accommodate this individual. It sounds very sad, but because that's why they're there, is to take care of people in crisis who need psychiatric services, but they have a right to deny. And so we look closely at that and we monitor which of our hospitals are denying admissions. So that's one thing. At the state level, there's a lot of changes happening at the state level, and in fact, they just are going to reopen Carroll, which is a long-term state facility where you have some of the most extreme needs people going to be admitted there. And they stay there for an extended period of time, months, sometimes years. And then you also have Hawthorne Center, which they are destroying or tearing down, and they're moving children to Walter Reuther. And they're also moving a limited amount of adults to Walter Reuther so they can redo Hawthorne Center, which is only gonna add 50 additional beds, I think they said. So you can have these facilities built and people need them. And there are some people who need long-term state hospitalization. They just really need that high level of intensive support. But they also need to support before they go, and they also need to support when they come back. So transition, imagine being somewhere for a long time, institutionalized setting, such as a hospital or even jail or prison, and then you're expected to be placed and come home. It's a setup because you need to have some kind of transition. You've been away even after a year. You need to find out what's going on in your community. You need to step down before you really fully step in and re-engage. So I'm off track, but that's the purpose of those hospital beds. One is acute care, which average length of stay, we would hope be 7 days or less. And one is long-term care, which is an application to the state. It comes to us, to the state, and it has to be approved before somebody can be transferred into a state hospital, a long-term bed. And if there's not one, you have people waiting in community beds longer. And I just think that there is such a thing as crisis prevention, and we need the full continuum of care to make sure that we give people every opportunity to get the services at the level so we can prevent full-blown crisis. So we can have, like we're partnering now with the Oakland County Health Department as well as Honors Health to do urgent care services. So we can prevent people from going to emergency departments or even needing to use our crisis center because we have that level of care available and support available so that hopefully we can divert people and get them engaged in the community services. And that's why this level is so important, because you don't want people being placed in jails and prisons because they have a mental health condition. You don't want people having to go to long-term state hospital care. And you really don't want people in and out of the hospital. So you really need to create the full continuum, and that's what those needs assessments do, is they tell us where are the gaps in our community of care. And that's why this partnership with the health department is so critical, because every program that the health department does, we can align with a behavioral health program as well and work together. And that's integrated care. That's really what it's about. So talk about infant mental health and addressing infant mortality, right? So we have infant mental health. We have infant mental health therapists that work with mothers who are at risk before the baby's even born to help support them with their mental health condition. So then we can have a healthy birth. We can also have a mother who survives childbirth. We can also have a baby that lives and thrives in their community. So I got off track, but
No, I
I'm
hear
very
you.
passionate about this work that we do together.
So what I hear you saying then is there is hospitalization is one conversation, but the conversation you'd rather have because it's more impactful is prevention.
Yeah.
Okay, understood.
Service at the community level.
Okay, and then the second last thing I was gonna ask or just kind of mention as a comment more so is just if you look at the last slide there, the one before, of your budget. Yeah, so I just did back of the envelope math that in 1999, Oakland County was providing 5% of your total budget. And so 5% of your total budget now would be more than $22 million? And it's stuck at 9.2.
And you know what, we have a handout, I don't think I had it, okay, was distributed, and it does break it down, and it does give you, and we didn't wanna come to you with this big number, honestly. We really wanted to say, this is what we're doing, and it's working. You know, and so if we have more, of course, we could do more. And most other parts of the state where they do this kind of contribution, it aligns with, it's sort of like a pro rata, or it aligns with our budget to a certain percent. So we could come here and be like, oh, well, we need X amount of dollars, but we don't wanna do that. We want your input, and we also wanted to make sure that we're on the same page with what we wanna do in some of these areas that we share responsibility.
Understood. So my then comment and then question is, so the comment is, thank you. I know some of us have had conversations, I think in the previous term, about like a public health millage, like what they do in Washtenaw County, or a mental health millage, like they do in other places in other counties in Michigan. And just again, back to the envelope math, I didn't know that this was the gap. But and let's not even think about services or whatever, but our prerogative as like the funding body of the county. $25 million divided by the 500,000 properties that get taxed by Robert, our treasurer, every year, is $50. I know that's not how millages work, but it's $50 a house, just to say. So here's my question then, what, with that gap or with what you say in this document, what are some of the things that you see as like things that need to be filled that are gaps?
Well, we have one crisis center for the whole county. I think we need an additional crisis center, and we definitely need to build more crisis mobile teams that go to the individual where they need to be served. I also think that we need to expand the number of co-responders we have, and we need to train the entire law enforcement community. And that includes colleges and universities where they have campus police or campus security. So we need to expand what we're doing and build on what we're doing. Also, you know, the workforce issue is huge. So our administrative rate for operating is less than 7%. So most of the funding we get goes directly to our providers for services. And so having that additional funding, we can go back to what Penny's question was, Commissioner, question was about how do we get the funding to the teams or staffing that are doing the work. With more funding, we can increase the rates of our providers. We can also do more programming that is community-based. So right now we have an access center that takes phone calls, but also they are on the same campus with the Resource and Crisis Center where Common Ground and New Oakland provides those crisis services. Those access points need to be in the community. They really need to be in those neighborhoods. Even if we put them in some churches or other places where we have people that we need to be serving or people that are being served have that access right there. It needs to be easy. Everybody doesn't have a computer. Everybody doesn't have a smartphone. So it needs to be somewhere they can go and get the services and supports. And what I'm finding about communities' culture, Oxford's needs are very different from Pontiac's needs. And you have to respect the culture of those communities so that they will accept the help. And if you say you're gonna do something and you're gonna be there, you have to be there. Because as soon as that first time you don't show up, you lose all the faith of that community. So that funding goes to building the community, building faith that we are here to support and help them, even in the most extreme situations. We don't want another mother and her kids to sleep outside. And we don't want another incident where we had law enforcement who were trained with a co-responder having to arrest a woman who was clearly having a psychiatric breakdown. She needed services and supports not to be treated the way she was treated. And so you have a training, but you have to also shift the culture, and that takes money and time to invest in what we're doing.
Thank you. Commissioner Joliet?
Hi, couple questions. This handout really helps. I was trying to understand your funding, so I'm trying to read through this pie. So you get most of your funding from Medicaid, if I understand this correctly?
Yes, probably 90%.
Okay. And then I see you've got the county match here of 10.1 million, if I'm reading that correctly. It's a county match to,
At that time,
Yeah.
that was appropriate in 1999. That was the original, or the county, wait a
this is
minute.
from a 22 total revenue budget. It's just one of the little pies within slivers within the pie.
Oh, okay.
It says county match of 10.1 million.
And for AARP, is that for?
Yeah, it says the county match of 10.1 includes local Oakland County appropriation as well as investments of 230 from tenant rental income.
Oh, that, wait a minute.
It includes some interest in there, so the 9.6 is the million is the standard, the 10 point whatever includes some interest, includes some local money.
Okay.
Yeah, but the 9.6 is always from the county.
And then there's a general fund. What is that general fund from the county
From the state.
or from the state? Okay. Okay, my question was, I was trying to understand your funding mechanism, how you're funded, so this actually answers all of it right there. And of the law enforcement co-responders, 6 communities, are those only available to communities that contract with the sheriff's department?
No, you know what I'm finding is a lot of the communities want it, they can't fund it. So they want the
okay, it's-
co-responder in their community, but they don't have the funding to support it.
Okay,
Troy
And
has
those
its own police department.
okay, I didn't realize that, okay.
And we actually employ the co-responders, we train them to work with law enforcement.
Okay.
So there are employees that are actually working with the law enforcement in those areas.
Okay, and then you had mentioned at the beginning, you built the crisis center that was through a grant?
Yes, the Youth and Family Care
SAMHSA?
Connection was a $10 million grant we received from SAMHSA.
Okay.
So we were able to take space that we already had within the Resource and Crisis Center and build out a crisis center and a screening center for youth and families in the same building. So we had that area used, one part of it was a conference room or something, and another part was for our access team. So we sort of squished our access team over and built this center because we knew there was definitely a need for that level of care.
Good job, good allocation of resources. Thank you.
Commissioner Gershenson?
Well, thank you, Dana, this was really interesting, and I'm sure we could continue. So I have a few questions,
Sure.
but short answers are good, and we
Okay.
can follow up after.
Good prompting.
You said you needed more funding for the mobile crisis units. Are you looking at funding from us, or who's your source of funding?
Well, what I'm looking at is one, is coming to you to say, these are the things that we could and should do with increased funding. So we're looking at ways that we can work with you to increase the amount of funding we get from you on an annual basis.
Okay.
So with that, there are several things that we can do, but one of those things that we wanna do is actually expand our mobile crisis teams. So either we employ the teams or we contract out for those teams. Right now, we have contracts with Common Ground as well as New Oakland, and it's not enough. one is staffing, but also two, making sure that accountability piece is in place
Got it.
that Commissioner Nelson talked about.
Okay. I would like a tour of the new
Okay.
facility. I'm sure other commissioners would.
Absolutely.
When you have a patient in the hospital, you said you have a hospital liaison, someone calls them. Is this specifically for a person that's identified with a mental health issue?
Yes,
Yeah. Okay.
yes.
The navigators that you have, there was a lot of controversy, a lot of discussion here about how many people are they actually helping? So I would like to get a number.
Which
or-
navigators? So we have mental health, school mental health
School
navigators.
mental health navigators.
Yeah.
So I'd like to
Okay.
get a little more detail on that.
Okay.
On Oxford not using all the money that we've allocated for them, are you gonna give that back? When is the determination on, so we can repurpose those funds?
What we've done is work closely with Leanne and her department to talk about, do we carry over and continue the benefit? And also what we've done is re-educate or notify the community that this benefit is available. And like I said earlier, the part of it is that some of the criteria and what we were asking people to provide and support, I think was a turnoff. I think we were asking
get
for
it.
too much
I
and
get
they
it.
didn't wanna disclose. So we've opened that up and reissued it. So our hope is that more people will take advantage of that. And we don't confine it to our providers within our network. If they have a provider outside of our network that they're using, we will reimburse or pay for those services as
Well,
well.
that's good, cause you've always gotta adjust those programs
yeah.
to meet the needs. On the transportation services needed, so we've now got a transit director, we just passed a millage. You know, I'd like to set up a meeting so that we get a feeling for where you need stops, because we've got all these flex services, we've got a ton of resources now that we didn't have in the past. So let's have that conversation with our transit people, so
Okay.
we can better understand. On this 9.6 from the county since 1999, does that come from our general fund? Does that come from your budget? Where does that come from?
It's like liquor tax money. Is that liquor tax money?
I think it just comes from some portion of your budget. I'm not
It's
sure
a
what
general
portion is
fund?
it.
It's the liquor, yeah, it's the liquor tax money that we receive.
I'm sorry, Leanne.
I'm sorry, liquor tax money
Okay,
Yeah.
so the liquor tax money that our county receives?
yes.
Okay, so I'm just looking at if we were to work on an increase, which of course we work with you on, because you oversee this, correct? We'd have to know where that money would come from. Because certainly a raise from 1999 seems within the realm of reasonableness, so, but we'd have to understand where that would come from. Also, you need to do a path with the universities to create a career.
Oh, yeah.
So we've been working on that with our ARPA funds and Oakland Intermediate Schools, and we've got great partnerships
Right.
through Jennifer Llewellyn, Michigan Works. So I'd also like to set up a meeting where we could talk to Jennifer about her recommendations and then reach out to our relationships, existing relationships with OU and OCC on how we could build that path. So take direct action, let's not just keep it a talking point, but let's set up that meeting so we can work with those universities to do that. Cause that's what that's what we're focused on with childcare workers, which we also have a shortage
We
of.
also submitted a proposal probably a year after I started that actually has exactly what you're speaking to. Because we've reached out and had conversations with Oakland schools as well. But like you said, it doesn't go a long
Well,
way until we pull it together.
let's bring us into it, let's bring
Absolutely.
Jennifer Llewellyn into it, cause she knows, she's a mastermind, so let's just work those things through. And also, there is a curriculum called Prepare You, run by a very dynamic young man. I've had meetings with him, I think his name is it Brian Beal or? I can get you the information, but I want somebody from your department, because I've been talking about this curriculum for quite some time. I want somebody to look into it. Brian Beal, I think is his name, and I have his contact information.
Okay.
I feel he's an unbelievable resource, and he's in several school districts nationwide,
Wow, okay.
and I wanna be sure he gets heard.
Okay.
Whether it works or not is up to you, but I wanna be sure someone is looking him up.
Okay.
Having a meeting with him, and I'm happy to provide the contact information.
Thank you.
Okay? I think that's it for right now, thank you.
Thank you. Thank you for your presentation, a lot to absorb. I'm sure we'll have more questions later.
Remember, this is draft.
Sorry, we have one more question from Commissioner Jackson.
And mine is very simple and
Okay.
a lot less dynamic than Commissioner Gershison's question she just asked. But you mentioned on the back of your cards, there's information on how to reach out. Can you give us that number? Because
Sure.
I get people and they're like, I need mental health services, but I don't know, in what lane, because we
You know,
do
it's
so
funny.
much.
Yep. When we went to the policy conference, another county had their board of commissioners and people who are in positions similar to yours have that information on their cards. And Christine has them,
Thank
and I
you.
had some packets too that actually have them in there as well.
And Janet, a lot of us have put that information on our political cards.
Yes.
And then remember, we did send out a card a couple years ago with resources to the entire community from our districts.
Yes.
We did send
I
that out,
remember
so
Targeted.
we could do that.
We have
I just
tons
needed
of
it for
things
my
that we can give
edification.
to you all, so you can spread the word.
Thank you.
Yeah, thank you. Thank you all.
Thank you very much. So we have a motion and support to receive and file this report. We can prompt the vote.
Just because it's been sitting idle here. Make sure it's all fixed up. Excellent, we have 7 yeas, 0 nays.
All right, motion carries, thank you. Our first item is from the prosecutor's office recommendations. It's an application to the Michigan Department of Health and Human Services for the fiscal year 2024 to 28, a cooperative reimbursement program, which this references child support payments. And we have Markeisha Washington here to address this, but I need a motion first. I have a motion by Commissioner Nelson, support from Commissioner Joliet. So thank you and welcome.
Good morning and thank you. My name is Markeisha Washington and I am the Chief of the Family Support Division at the Oakland County Prosecutor's Office. We come before you today to ask for approval of our application for a 5-year 4D grant. The Family Support Division at the Oakland County Prosecutor's Office helps to establish child support orders and paternity orders for families throughout Oakland County. We are comprised currently of 24 staff members. 4 of those are attorneys. We have three investigators and remaining are support staff. Our 4D grant, more specifically, is actually a pass-through grant. The grant comes from, it's a federally funded grant, so the funds come from the federal government, passed down through the state of Michigan, and then the state will subsequently disperse the funds to the county. More specifically, in this particular case, our grant is funded 66% by the state, and then the county would have to match the remaining 34%. And so, according to the application, the amount that we're looking for from the county would be $10,216,201, but for a total budget amount of $30,047,648. But again, that's over 5 years.
Thank you. Any questions? Commissioner Joliet?
Is this a typical, in the past, have we done this match?
Yes.
Or is the average amount of money that's asked for this match, a 33% match?
Yes, in fact, the amounts or the budget that you see before you, in fact, this is given to us from the state. So these numbers are not, for example, we don't, as a prosecutor's office, we don't go to the state and say, this is how much money we need. What they do is they look at our spending from previous years and then they dictate or kind of decide based upon your previous spending, based upon taken into account inflation and terms of hiring, this is how much money we budget out. But it is always 66% is covered by the state, and it's always 34% covered by the county.
Okay, thank you.
Thank you. And Commissioner Powell?
So with this fund, is this something like, is this as new cases that y'all establish and use these funds for that? Or is this for existing cases of someone who may have run into the other fraternity parent going off somewhere and you all kick in to assist with that? Or is it both?
So it's for both, and just to put it into perspective, approximately last year we filed approximately 1,400 cases on behalf of families in Oakland County. And that does not include, that's just what we filed here in our county. That does not include, sometimes we do get referrals. Our referrals come directly from the Office of Child Support, and sometimes between when we get that referral, maybe someone has moved to either Macomb County or Wayne County, and then we will transfer those cases to those requisite counties. So the 1,400 is what we filed in Oakland County, but that does not include, I think we received well over 3,200 referrals last year, which is why we have such a large support staff.
I'll contest to this type of a program. It does work.
Thank you.
Thank you.
Thank you.
I agree. Any other questions? Commissioner Bell?
Just real quick.
Nope,
you
I'm
said-
good.
Yeah, we just said real quick that there were 1,400 cases filed, but 3,200 requests.
Yes.
So that means there are people in Oakland County who moved to a different county that are now needing to pay their child support that were in Oakland County.
No, let me clarify. So when someone is looking for, if someone is looking for some type of assistance, they have to contact the Office of Child Support, and then that referral, their information is sent to our office. So it would be, typically, it's the parent who has custody of the child. We call them the custodial parent. Our office received approximately 3,200 of those referrals. Now, once we get those referrals, we have to do a little bit of background check. One, we have to make sure that the party who has the custody of the child, that they live in Oakland County. We also have to make sure that the address provided for the other party, the non-custodial parent, is a viable address. Sometimes we don't have a viable address. And sometimes that individual may have moved, that's where I say to a different county, and that's where we have to send it off to the other counties. But from there, and there could be other reasons, sometimes if there are domestic violence reasons, we won't file a case. But we do look at every case individually, and we do an investigation before we file it. And as a result, we filed approximately 1,400 cases last year.
Okay. So the 3,200 minus 1,400, those people don't live in Oakland County but have a parent or relationship to the county.
It could have been another reason why the difference with the 3,200 and 1,400, it could have been a number of reasons why we didn't file. For example, not necessarily that the non-custodial parent didn't live here, but maybe the custodial parent. We can only file if the custodial parent with the child lives here. If the custodial parent with the child moves to a different county, we have to transfer to that county.
Okay. All right, thank you.
Any other comments? All right, prompt the vote, please.
No 78-0 nays.
Motion carries, thank you.
Thank you.
Our next item is from the Circuit Court, is to restore youth assistance casework position for Mentors Plus. This has been a topic for us in the past and at board meetings, so I think we're all looking forward to this. So who would like, I have a motion by Commissioner Nelson, support from Commissioner Gershenson. So thank you for being with us and talking about the Mentor Plus position.
And thank you so much for entertaining and listening to our request and actually really supporting this request going forward. The Mentors Plus program has been around for many years. It helps many people across the county. When the difficult decision was made by my predecessor and the former court administrator to make those budget cuts to try and keep our budget in line, that was a tough choice for them. But after hearing so much public outcry, we really would like to come back to the board, and I think the board is supportive of reinstating that position in the current funding year, and then we've also requested it going forward for next year's budget.
Thank you. So I am happy that Mentors Plus is restored. I am unhappy that my class and youth assistance caseworker went to the Mentor Plus program.
Sometimes it's hard to keep a good person, right?
Yes, she's a good soul and will do well there. Any other questions or comments, Commissioner Cavell?
This is great and I'm glad we're doing this and thank you for your advocacy, you both, but really thank you. But where did we, and this might be a question for Mike Andrews, where did we find the money for this?
So it might be a question for Kyle Jen or for someone over there for a fiscal analyst, but I know that the court currently has favorability in this budget year, and they might be relying upon that. We do have in our, we've had several positions, we all know it's difficult to fill positions right now, and so there is some favorability in our budget for human resources.
Okay. Thanks.
Anything else? All right, prompt the vote, please.
Shields, right?
We have 7 yeas, 0 nays.
Motion carries, thank you.
Thank you.
Our next items. Oh, I'm sorry, the next item is from the district court recommendation, the 52-1 District Court Novi, an amendment to the Michigan Mental Health Court Grant Program. So this item is accepting additional monies, which is a good thing to hear. Who would like to make, I have a motion by Commissioner Joliet, support from Commissioner Powell, and Alexandra Black is here via video to talk about this item.
Good morning, or afternoon, I guess. Thanks for having me here. I just wanted to present that we did receive our original grant amount of $31,543, which was exactly what we got last year. We knew it wasn't going to be enough to be able to fund our new liaison officer position from the OCHN, which is greatly needed for the program. So we went back to the State Court Administrator's Office and were able to receive funding of $41,298 that will assist us in continuing that position and being able to fund it for the rest of the year. So I'm hopeful that with showing them that we can use this money when we apply next year, we won't have to get a small amount and then ask for more money and have more continuity within our program. We're also going to be asking for more money. Just a heads up, next year we want to try to expand the program and maybe get more probation officers because we do have obviously a great need. You heard a large presentation this morning on what a need this is. So we're really pleased with our partnership and we just need to be able to accept this money.
Thank you. Any questions or comments? All right, prompt the vote, please.
Gershenson. You have 6 yeas, 0 nays.
Motion carries, thank you. Thank you for spending time with us. Our next 4 items are from the Sheriff's Office. The first is an application to the Department of Justice for the Bulletproof Vest Partnership Program. The next is acceptance from the Michigan Department of Natural Resources for the Marine Safety Program. The third is use of the forfeited funds for canine training. The fifth is looking at an agreement for an auxiliary department service deputy services with the city of Keego Harbor to assist with special events on an overtime basis for regular deputies. I would also, I have a motion by Commissioner Gershenson, support from Commissioner Joliet. I would also like to say before we begin our items that past items have been regarding use of officers at the Somerset Mall and Notre Dame Academy. So that is still being reviewed by our staff and corporate counsel, and that will be returning to our committee when that process is done. Okay, and welcome to Major Wondrick and Gaia Pier. So first item is talking about the Bulletproof Vest Partnership Program.
Yeah, so this is our annual application. This year we're asking for a little over $175,000. We typically don't get that much. Usually it ranges from 0 to, I think we've gotten maybe 30,000 at one point in time. We have a 5-year replacement schedule for our vests. So what we do is just take that, our number of deputies divided by 5. So this year we're asking for 232 vests at approximately $755 a piece. So hopefully we'll be back with an award at some point.
Thank you. Are there any questions regarding the bulletproof vest? Okay, next is the Marine Safety Program, accepting a grant of about $168,000.
Okay, so this is an grant acceptance. As you said, it's our Marine Safety Grant for 2023. It's $168,600. It's split between state and federal funding. It's for salaries and wages and operating costs, and no equipment in this one. The state portion of $49,500 requires a $16,500 match from the county. The federal portion does not require a match.
Thank you. Commissioner Gershenson?
And is this the program that State Senator Rosemary Bear advocated for us?
No, that was the enhancement funds that we brought to you previously. This is our annual grant through the state of Michigan.
All right, thank you.
Any other questions? Okay, the next item is using forfeited funds for canine training.
Yes, canine training and specialized deputy training. So I think we've had that conversation over the last few years where our training funds have kind of ebbed and flowed. So we are asking this year, we had some other canine changes. We've had a couple of people retire, so we have some new people in the unit that need additional training. And then we've had to replace some canines that aged out. Obviously, we bring the retirements to you when that happens. We also unfortunately had one that had cancer that had to be euthanized, so we had an additional expense for that this year. So we're asking to use forfeiture funds to take care of all of that.
Thank you. Comments on the training? Commissioner Cavell?
Just cool to say thank you. Quick question about forfeiture funds. It's a pot of money, right? You split it with the can you explain how much there is and who it goes to?
Yeah, so we get forfeiture funds. The prosecutor was a part of the narcotics team, so when they brought their forfeiture resolution, it was for money. So we split it with all of the local units that have an officer in with us. So depending on what their participation was throughout the year, in December, we do an annual distribution to everybody. So we get a portion, they get a portion based on what their timing was, because sometimes they have an officer, sometimes they don't. So depending on how much time they spent in the unit for the year, they get that percentage of a distribution, so.
Who's the distribution, just prosecutor and sheriff, or are there also local?
No, it's all the local, so everybody that participates in it, so.
Do you know how big it is roughly?
It depends, because we transfer to the prosecutor's office, so I don't know what their size is.
Okay.
And then we have different, because we have federal, we have state, we have omnibus, and we have treasury, so federal and state are obviously the biggest ones.
Cool.
Thank you. All right, last item, the agreement for an auxiliary deputy service with Keiko Harbor.
Yeah, so this is a new agreement, and I want to thank your staff up front because this was a really quick turnaround just because of the timing. And there's only one set of meetings in June for the board, so obviously the next one would have been past the 4th of July holiday, which they're asking for services. So this is similar to the Wixom agreement where they're asking for deputy services. Right now we have an agreement with Keiko Harbor for Marine, but not for auxiliary services. So that's what this is doing, and they will fill out, there's a form on the back for supplemental services. They'll list the number of deputies and the ranks requested, and then they get charged the overtime rate that was established by the board, so the regular overtime rate. Or if it falls on an actual holiday, then they would be required to pay the holiday rates.
Thank you, Officer. Commissioner Nelson?
Thank you, Madam Chair. We've had many conversations in regards to Marine Patrol, and I greatly appreciate the efforts that our Marine Patrol and our sheriffs in general have put forth in regards to leading into summer season, especially around Keiko Harbor and Cass Lake. Specifically, we all know and probably have heard before, the sandbar can get a little wild and crazy. Lots of people coming out from all over Oakland County. With that being said, so I just wanted to seek some clarification. You mentioned that Kegel Harbor presently has a marine contract. When you say a marine contract, does that mean a contract that has boats in the water?
Yes, so the agreement that we did last year, so Kegel's obviously a little bit different because we
Sure.
have the enhancement funds that came through Senator Bear's office that we have dedicated. Some we have marine safety, I think some jump boats. It's a little bit of a unique situation, and then they also have that agreement from last year. So
the reason why I ask is I travel between that little portion on Cass Lake Road multiple times a day, especially given now that we're leading into summertime, since Memorial Day weekend, leading into now just recent weekend. Within that 200 to 300 foot area on Cass Lake Road that's going around the sandbar, there have been 7 to 8 sheriff vehicles just parked along the side of the road with their lights on, pretty much from your peak hours of 11 a.m. to 5 p.m. Right? And I know that it's a very unique situation because there is private property between where they are and where the water begins. With that being said, if I'm understanding the present contract now coming before us, there's already what appears to be, and it's pretty consistent throughout now the weekend leading from Memorial Day to presently, that there's already 7 to 8 patrol vehicles and 2 boats on trailers that are either in the turn lane or humped up on the curb. So lots of questions have been and are asked in regards to why are there so many patrol vehicles on the road and on the curb, and why is there at least 1 boat trailered, if not 2 boats trailered, that aren't even in the water? So what's the purpose of having that many patrol vehicles, that many officers, and then having 1, if not 2, boats just trailered sitting on the road, in which, by the way, are facing the wrong direction, that if an emergency was taking place, they would have to turn around and head north to get to Dodge Park. So can you help me understand what in the world is going on?
Well, depending on the timing and what vehicles are there, those are just our marine deputies, whether they're parking their cars once the boats are in the water.
But I don't see any
Okay.
boats in the water.
Well,
That's just
We have,
it.
and the 2 on trailers may be jump boats, coming through as an additional patrol, but there should be boats on the water as well. And these are, without talking to Sergeant Burwell, I won't know exactly who was there, but it sounds to me it's just our Marine Division parking their cars while they're, enforcing the sandbar.
So I would like to gain, I support what's coming before us today, but I definitely have a lot of residents who are asking questions in regards to why are we having just parked vehicles on the road, on the curb, with their lights flashing 8-10 hours a day, and then having 1, if not 2 boats just sitting all day long in a turn lane or on the humped up side of the road. So it would be really great, and maybe offline I can reach out to Sergeant Burrell myself. I know he and I have had many conversations in the past. But the reason why I really emphasize on what I'm saying right now is because we need to make sure that we have boats in the water.
Yes, and there are boats in the water.
I would love to gain more insight on that. And the other thing, please, it'd be great to have the boats that are trailered facing the right direction, because in the event of an emergency, every second counts. And so I know that's been a more recent chatter throughout the city over the course of the past couple weeks, because God forbid there is an emergency. It's quite a feat to turn those vehicles around in that small of an area on Cass Lake Road. So thank you. Thank you, Madam Chair.
To clarify, so these are full-time deputies too, like you said, that's the Marine section that's separate. These will be full-time deputies for the 4th of July event. So I don't know if there's a festival or something, because they specifically asked July 1st through the 4th.
But they're not Marine Patrol.
These are not Marine.
These are just the auxiliary.
These are auxiliary, these are regular deputies, and or sergeants coming in, depending on what they ask for.
So I'm sorry, Madam Chair, may I have a clarifying question?
Next one, last one.
Last one, excellent. So in regards to the sheriff deputy's rank, so you have lieutenant, sergeant, deputy 2, and deputy 1. Cost is varying, right? Especially those overtime rates. It's a lot of money.
Yes.
Well deserved, but a lot of money. How does one choose whether a lieutenant goes out or a deputy one goes out? Because the cost is significantly different of an hourly overtime rate between those ranks.
Well, at first it comes with a request of the community, what they're looking for. We like to have a supervisor with our deputies. Normally it'd be a sergeant in a small detail like this. But with our contract with our union, if they don't have enough people to fill it, they'll open it up for command to fill it. So depending on the staffing levels, it could be a sergeant working a deputy's position to cover the overtime without forcing somebody.
Okay. And having, if contingent upon passing, which that means that there'll be 12 officers so 12 patrols in less than a 200-foot area.
No, what they're looking at putting is, putting one to two deputies on shift, and they're gonna do a swing shift, one in the early afternoon and one to the evening. So they'll have a total of 3 deputies per day.
So the 7 to 8 patrol cars that have presently been there over the course of the past now 3 weekends is the 4 auxiliary officers patrols in addition to now the 7 or 8 vehicles?
They'll be patrolling the communities to help with the influx of people coming in for the holiday weekend. That's what this is for the most part. Not enforcing marine law, the additional manpower.
Sure, but it sounds like that's what the already 7 to 8 patrol sheriff officers are doing, given that they're on foot, not on the lake.
Well, they can only enforce marine law as marine deputies.
On foot.
I'll have to give Sergeant Burwell, so I don't know exactly.
I got you. Thank you. Thank you, Madam Chair.
Yes, but these are separate from this agreement.
Oh, I get that.
Those are
100%.
So.
So we all know this is one of our busiest lakes. So this is with the Kego Harbor portion of it. Is West Bloomfield requesting any extra assistance?
No, not at this time.
And do they have marine patrol? No.
No.
And then what's the other one? Is it Orchard Lake?
Orchard Lake.
And have they requested anything?
Not we have the current agreement with the Marine Division, but nothing additional for the holiday weekend.
But they have a contract, Orchard Lake.
Correct.
So the only one that doesn't is West Bloomfield.
Correct.
But what we've been able to do, because I think the board last year gave us an additional 50,000 for patrols, and that primarily went to hopefully, dissolve some of the Cass Lake
And I bring that up.
craziness, yes. Well, then this year, we didn't request the 50,000 because we did get the enhancement grant from the senator's office. So that is covering the additional patrols and helping us to expand the patrols without coming to the board for any additional funding. We got that grant that we assume is a one-time funding, but that's what's funding any additional patrols that we're able to do this year on the
That
marine side.
includes the West Bloomfield portion of the lake?
The whole lake.
It would be, yes.
Okay.
And then we respond to any emergency, obviously, any call that we get, we respond to, whether or not they have a contract.
Thank you.
The contract are additional patrols.
Great, thank you. The 4 items under sheriff's recommendations, would you prompt the vote, please? Motion carries, thank you.
Thank you
Very
for your
much.
support.
Our last scheduled item on the agenda is from Health and Human Services, from the Neighborhood and Housing Development, acceptance from the State Land Bank Authority for the initial capitalization cost of the Oakland County Housing Trust Fund. This is addressing creating additional units of affordable housing over the next decade. I have a motion by Commissioner Gershenson, support from Commissioner Cavell. And welcome, thanks for waiting with us.
Yes, thank you. Can you hear me?
Yes.
If I could take one moment, because I am very excited to announce our new Neighborhood and Housing Development leadership. They have been on board for just over a week, and I can tell you, I'm very excited about this team. So I am gonna let them introduce themselves, if that's okay, and who they are, and then I'll get back to the item, so.
Thank you.
Hello, everybody. I'm so glad to be here. My name is Khadijah Walker-Fobbs. Stepping on board here, as like Leanne said, 1 week in as the new officer and deep diving in with both feet ready to roll and do some amazing things here in our county. I come with over a couple decades of experience in a wide range of human services. I have served most recently as the Chief Strategy Officer of a local human service agency here in Oakland County. I have overseen a housing nonprofit in Southfield focused on youth aging out of care and youth homelessness. I've also served in many roles around community health, working with some CDC initiatives around equity. So I'm excited to jump in with both feet and happy to be here, so thanks.
Thank you, welcome.
I don't think we need that.
Oh, yeah.
I was gonna say, otherwise they're speaking really loud at the end of the table. So
I've been trained to push that button, so, right.
Anyways, I'm Kyle Hines. I am going to be serving as the Housing Trust Fund Manager here at the county. Very excited. I know there's a lot of excitement around this. I am personally very excited. I come to you from the city of Dallas, where I was an assistant director in the Housing and Neighborhood Revitalization Department, where I ran any unit that was funded, developed, preserved, created, homebuyer assistance, anything like that rolled up through my team. And I also ran our Public Instrumentality Corporation. So the Housing Trust Fund is very similar to that. So ready to dig in with that. I am actually a native of Michigan. I grew up in Lowell, Michigan, just outside of Grand Rapids. Went to Michigan State, left for about 18 years, but now I'm back because I have a 7-month-old son and he requested to be hanging out with his family. So that's why I'm here. I'm very excited to get to meet every one of you. And if anybody, I'm more than happy to talk about the goals of the communities that you represent and how we can best move forward with providing workforce, affordable, attainable housing.
Thank you. Commissioner Powell?
When you start the question segment, I'm sorry.
She's already got a question for us, So what we are requesting here is to accept up to $400,000 that was provided by the state land bank. And we also have our land bank representative here, so she may need to help answer some questions as well. So this is actually from a brownfield development in Commerce that will generate $550 tax revenue. And so the revenue will be up to $400,000 that will go into the Housing Trust Fund. It will not be used for administrative costs. This will be specifically to build affordable housing. So we are expected to get $150,000 from tax year 23 and $250 from tax year 24. And again, it's up to $400,000 is what we are expected to receive.
Thank you. Commissioner Powell, followed by Commissioner Gershenson.
I want to, first off, I represent Pontiac. So I know that I'll be on you all's radar a lot. So I am ready to work. I'm ready to work and everybody let you know I am a commissioner that works. So, not saying that none of my other commissioners, I just have a lot more, the demographic state, we got facts. My district is one of the more challenging districts, so it's okay though. I just really want to say I'm just happy you all are here. I'm happy we finally filled those positions. But help me understand, and this is just for me, for internal, how is housing under you, Leanne, and you health? So how does all of that go with this chart? I'm just,
I've got to stop moving this over to me. I gotta remember that. I've been virtual for 3 years. That's the difference. So about 3 years ago, right, when new administration came in and they really looked at how things were structured in the county. They really saw a huge connection, obviously, with the social determinants of health, right? We've talked a lot about that and how health and housing really collide in the synergy between them. And so about 3 years ago, we changed the direction and we put health and housing under Health and Human Services.
Got it, okay.
So as the director over Health and Human Services and the interim health officer for now, that's how I'm bringing housing. So usually you see Shane, he brings most of these items. Sometimes I'll bring health. So we'll start to work together that they'll continue to bring housing items. I'll help as needed, but these are very, very well qualified and ready to dig in.
That's cool. I just was wondering what our floor chart looked like. Yeah. So thank you.
Thank you. Thank you. Commissioner Gershenson?
So we are so thrilled to have you on board. I mean, it's been a frustrating year where we've been waiting and the community's been waiting, and I know you have a great advisory commission for the land bank. I'm assuming you do not have cards yet?
No, unfortunately not yet.
So I'm gonna give you mine because I'd like to set up a meeting. I'd love to talk about affordable housing in my districts, but I'd like to get to know each of you personally. So Here's my card.
Thank you.
Whoops.
We'll get it.
We'll grab it.
We'll get it.
Yeah.
I have
So I'd
Tyrannosaurus.
love you to reach out to me and I'm sure there'll be other commissioners that wanna join us. Thank you.
Thank you. Any, Commissioner
question.
Joliet?
So this funding is because of a project is happening, correct, with this commerce project?
And yes, the project
So otherwise
is-
that
yeah.
would not have been it's captured from that.
Correct, it's a
Okay.
one-time funding that
Okay.
we'll receive that will be put in directly into the Housing Trust Fund.
Okay, thank you, just clarification, thank you.
Thank you. Anything else? All right, prompt the vote, please.
You didn't say nothing.
I already talked to her.
Oh,
Yeah.
You can wait that.
We were at the citizens advisory.
Oh, okay, all right.
Khadija, we have beef from years ago.
Yes.
I just hate this.
All the way back 2 days ago.
Thank you for being with us.
Thank you so much.
Thanks. Our last scheduled item on this agenda is public comment. Is there anyone from the public wishing to comment? Commissioner Nelson. are
Thank you, Madam Chair.
commenting as
Just
a-
briefly, while we've got our health department here, I want to give a gracious shout out. I volunteered at Ferndale Pride, and I loved seeing not only the Oakland County Health Department have a table and vending stuff going on, but I also thought it was really great and amazing to have a table of the Oakland County Harm Reduction Program, and they were giving away Narcan.
And
again-
t-shirts.
And t-shirts, which Charlie is wearing proudly, but thank you. I know how busy it can be, and to have staff dedicate weekend hours to attending and distributing and engaging with members across our communities at events that are very well traveled. So thank you. It was a hot day, but my gosh, it was great seeing everybody there.
Thank you so much, appreciate that. I will pass that along.
Thank you, thank you, thank you. Thank you, Madam Chair.
Anyone from the public wishing to comment? All right, public comment is closed. There is no other business to come before this committee at this time, so the meeting is adjourned at 12:45. Thank you, everybody.